Which type of catheter is generally used for client with urine retention? A. Cowed. B. Indwelling urinary. C. Straight. D. Three-way. And the correct answer is B. Indwelling urinary. Indwelling or retention catheter mainly used for urinary retention for a long period. Straight catheter used only for short period, and three-way used in irrigation purpose. Curved catheter is curved at the tip, so it may be used in urinary obstruction into BPH. What should be the correct direction of cleaning any catheter? A. Less clean to more clean. B. More clean to less clean. C. Using circular strokes. D. Any of the above. And the correct answer is B. More clean to less clean. It is a general principle of sepsis that always clean an instrument or site or any wound from more clean to less clean area. A Foley's catheter drainage working under the principle of A. Osmosis. B. Diffusion. C. Gravity. D. None of above. And the correct answer is C. Gravity. Which urinary catheter is used most commonly? A. Malacot catheter. B. Metal catheter. C. Foley's catheter. D. Pacer catheter. And the correct answer is C. Foley's catheter. Nursing intervention designed to decrease the risk of infection in a patient with an indwelling catheter includes A. Clean area around meatus. B. Empty catheter drainage bag at least daily. C. Change catheter and bag every 48 hours. D. Maintain fluid intake 1.2 to 1.5 liter daily. And the correct answer is A. Clean area around meatus. Giving perineal care including cleaning area around meatus twice a day decrease the risk of infection in a patient with indwelling catheter. Empty the catheter drainage bag at least 8 hourly because retention of urine in a bag is an excellent source of growth of microbes. Maintain adequate fluid intake between 2.5 liter to 3 liter daily to prevent retention of urine. Change catheter tubing and bag at specific interval according institutional policy. Maintain the drainage tubing and collection bag below bladder level to flow urine by gravity. Which of the following is a primary intervention necessary for all patients with a Foley's catheter in place? A. Maintain the drainage tube and collection bag level with the patient's bladder. B. Irrigate the patient with 1% neosporin solution 3 times a day. C. Clamp the catheter for 1 hour every 4 hourly to maintain the bladder's elasticity. D. Maintain the drainage tubing and collection bag below the bladder level. And the correct answer is D. Maintain the drainage tubing and collection bag below the bladder level. What nursing action must be taken to prevent hospital-acquired urinary tract infection among patients who are on indwelling catheter? A. Maintain a closed urinary drainage system. B. Use clean technique for catheterization. C. Ensure an adequate intake of IV and oral fluid. D. Position the drainage bag higher than the bladder level. And the correct answer is A. Maintain a closed urinary drainage system. It is essential to maintain a closed urinary drainage system to avoid hospital-acquired UTI and always use sterile technique for catheterization. To avoid pulling the urinary catheter, nurse should tape the catheter on patients. A. upper thigh, B. lower thigh, C. hind leg, D. foot. And the correct answer is A. upper thigh. To avoid pulling and constant friction on the neck of bladder and urethra, the catheter should be tapped on the inner aspect of upper thigh. Inflating the balloon before seeing urine draining in the tube can result in A. urethral trauma, B. dilation of urethra, C. pruritus, D. infection. And the correct answer is A. urethral trauma. Urethral trauma can result because expansion of balloon into urethra can traumatize the urethra. The possible cause of retention of urine includes accept A. urethral obstruction, B. surgery and trauma, C. drugs like albendazole, D. decreased stimulation of muscles of bladder. And the correct answer is C. drugs like albendazole. The possible cause of retention of urine include urethral obstruction, atonic muscles of bladder, lack of muscle tone and decreased stimulation of muscles of bladder due to spinal injury. During a retention catheter insertion or bladder irrigation, the nurse must use A. clean equipment and techniques, B. clean equipment and maintain surgical asepsis, C. sterile equipment and maintain medical asepsis, D. sterile equipment and wear sterile gloves. And the correct answer is D. sterile equipment and wear sterile gloves. Which of the following solution is not indicated for bladder irrigation? A. sodium bicarbonate, B. potassium permanganate, C. sodium nitrate, D. boric acid. And the correct answer is A. sodium bicarbonate. We can use following solution for bladder irrigation like sterile water, normal saline, glucose solution 5%, boric acid 2%, potassium permanganate 1:10,000, silver nitrate 1:5,000 and acetic acid 1:400.